Welcome back to the Mid-Modern Eye Care YouTube channel. Today, we're discussing a very underutilized and sometimes misunderstood treatment for dry eye, meibomian gland probing. So to start off with, the meibomian glands. Those of us who are seasoned with suffering from dry eye know that the meibomian glands are the little oil glands inside our eyelids. These oil glands are an important part of keeping our eyes from drying out. The challenge a lot of us with dry eye face is that those oil glands get plugged over time, and when they're plugged, they stop producing oil, and then our tears evaporate too quickly off our eyes. That causes our eyes to get more inflamed and more irritated, and in turn causes them to feel more dry and red, itching, burning, all sorts of things. So it's kind of a negative cycle of things being inflamed, and then they get more inflamed because they're not getting taken care of. I have noticed in my clinic that there's about 20% of patients that we get them through the IPL treatments, and then still at the end of those IPL treatments, they're still having some trouble. If you don't know what IPL is, it's one of the treatments that we use to treat meibomian gland dysfunction, basically to help get the oil glands functioning again. I have a separate video that talks a little bit more about IPL. But back to meibomian gland probing. I have found that those 20% of patients that don't improve as much as I'd like, they tend to have oil glands, meibomian glands, that are very, very plugged to the point where the oil gland can produce oil, but the oil can't actually get out of the oil gland. So the probing procedure, simply, I'll put a video, a little short clip showing some of it. Basically, where we have to open the top of the oil gland up again. I don't use a needle. It's actually a very, very small filament. And that is what we use to open the oil glands back up. I use an anesthetic, so a numbing eye drop. And then I have an ointment that helps numb the eyelids a little bit. We rub that ointment into your eyelids, and then we wait 5 to 10 minutes, depending. I have you blink a couple of times, close your eyes, blink a few more times, because we want to get that ointment in, so it has time to work. Otherwise, meibomian gland probing can be quite uncomfortable. Sometimes even with the ointment, it's not like super fun, but most of the time we can get it so it's tolerable with the ointment. After I've applied the ointment and given it enough time to work its magic, then there's anywhere from 10 minutes to a half an hour sometimes of just taking time and going through and opening the oil glands back up. Those that have had some probing done before on their oil glands will know that there's some, there's a 1 millimeter probe, there's a 2 millimeter probe, there's a 4 millimeter probe. I tend to use mostly the 1 millimeter and 2 millimeter probes. A lot of times we can get oil glands functional with the 1 millimeter probe. Occasionally we need a 2 millimeter probe. I put up a picture right here that shows a patient that has had the probing procedure done and then followed up with a tear care procedure. So that's where we warm up the eyelids for about 15-20 minutes, and then I physically get the old oil out of the oil glands. That is very, very effective. And the amount of oil that you see in that picture, that is off one eyelid, one lower eyelid. Currently, that is my process. I do the probing procedure, and then I warm up the eyelids somehow, tear care, heat mask, whatever, and then I work on expressing the old oil out. That's important. I'm not a big fan on expressing, if oil glands are plugged and I know they're plugged, I'm not a big fan of, pushing on them all the time and really squeezing on them. But once I know that they're open, because I just did the probing procedure, and I know that they're warmed up above ambient temperature, then that's when we work on getting the old nasty oil out. Another piece of the puzzle, and I'll make a separate video on this, frequently patients that have the probing procedure done will also end up needing to have an omega-3 supplement. I came to omega-3 supplements pretty reluctantly because I had a lot of patients that would try them and would never improve on them. There's a couple of reasons for that. Most omega-3s are garbage and don't help. And if you're on an omega-3 supplement and your oil glands are plugged because you need a probing procedure done, then that's not going to help just taking an omega-3 if the oil can't physically get out of the gland. After I finish the probing procedure, I like to flush the eyes really well with a sterile saline. That does a couple of things. It gets the ointment off your eyelids and off your eyes. It can irritate eyes a little bit if we leave too much of that ointment behind. Also, it's nice to flush any inflammatory, any cytokines, prostaglandins, anything that is on the surface of the eye that might be contributing to inflammation. It's nice to get those flushed out. So it's kind of a, we're doing two things with flushing the eyes out, getting the ointment out, reducing some of the inflammatory burden on the front surface of the eye. If you have any questions, feel free to give us a call here at the clinic or visit us on our website. Also, if you would like to schedule an appointment, you can schedule appointments on our website as well. We appreciate you visiting our YouTube channel. Remember, you have two eyes, and one of them is not just a backup. We'll see you on the next one.